Imagine you're at the auto repair shop, and the person in front of you gets a bill for $3,000. You're feeling really bad for the customer until you overhear him say he hasn't had any preventative maintenance done in 3 years. You start to lessen your sympathy by telling yourself he deserves it. He didn't do any preventative maintenance on his vehicle. You're feeling pretty good about yourself until you go to your next appointment for the day, which is your primary care doctor's. He says you're long overdue for a colonoscopy, cholesterol screening, and you need to start living a more healthy lifestyle. It seems we take better care of our vehicle's preventative care than we do our own. Primary prevention and screening tools are key to decreasing the severity and financial impact that chronic diseases have on the American population. It is through preventative medicine and screenings that diseases can be identified earlier, thus the severity and financial impact will be lessened. Primary prevention is key to decreasing the severity and cost of disease. Primary prevention focuses on the removal of the cause for the disease, such as immunizations as a child, or modifying a risk factor by maintaining a more healthier lifestyle. Focusing on nutrition can have a dramatic impact on health and wellness as a primary prevention. Nutrition can decrease your risk for obesity, diabetes, certain cancer, and heart disease. The American Heart Association's website suggests following the DASH diet to lower your coronary artery disease risk. Another guideline set forth by the American Heart Association to maintain a healthy heart is to exercise moderately 2.5 hours a week, or 1 hour and 15 minutes at a vigorous level. Combining nutrition and physical activity appears to have an impact on all aspects of health and wellness. Secondary prevention is a focus on identifying a disease at its earliest stage. Secondary prevention consists of tests and tools. According to Dr. Susan W. Fletcher and Robert H. Fletcher, a good screening test needs to have high sensitivity. Because if only sensitive late in the disease process, the screening is useless. Preventative screening such as prostate-specific antigen labs, cholesterol levels, colonoscopies, pap smears, mammograms, and blood pressure checks are good examples of screening tools. Prostate screening should begin at age 50 for the average man and 40 to 45 for the high-risk man. Identifying prostate cancer early can reduce the need for chemotherapy and radiation, therefore reducing the overall cost of healthcare. The optimal screening interval for hypertension is not known, but recommended to start at age 18 with each primary care visit, and then at least yearly for them over 40. Hypertension left untreated can cause kidney disease, heart failure, and stroke. The American Heart Association's article, Lifetime Costs of Medical Care After Heart Failure Diagnosis, states that in 2008, heart failure consumed $34.8 billion in the United States. The cost of stroke annually in the United States is estimated at $34 billion. That is a staggering $78.4 billion Medicare dollars consumed by stroke and heart failure treatment alone, both of which, if caught early through screenings, can be treated to avoid progression. One arm hug a year by a blood pressure cuff can help identify hypertension and prevent progression of hypertension-related diseases. Perhaps the largest measure of prevention is cardiovascular risk screening tools, as it encompasses many lifestyle modifications that can prevent other diseases from forming or progressing. Charles Heineken published an article in June 2016 entitled The Overview of Primary Prevention of Coronary Heart Disease and Stroke that found cardiovascular disease is the leading cause of death worldwide. Heineken's article states the following as risk factors that can be modified to help prevent heart disease in the United States: smoking avoidance and cessation, overweight and obesity, diet, physical inactivity, dyslipidemia, hypertension, and diabetes. Cardiovascular disease risk has a large amount of modifiable risk factors that, if followed, the risk of developing heart disease prematurely is very low. Genetics play a role in the risk of developing cardiac disease. The modifiable factors should not be ignored. Cancer preventative measures overlap many of the preventative measures for coronary artery disease. It's a buy one, get one free. A May 2016 article published by Nancy Sokol cites the following as cancer preventative measures: tobacco avoidance, remaining physically active, having a healthy weight, eating a diet dense in fruits, vegetables, and whole grains, low in saturated fat, limiting alcohol consumption, guarding against STDs, avoiding excess sun, and getting regular screenings for breast, cervical, and colorectal cancer. Dr. Sokol recommends screenings for breast cancer should begin at age 40 and continue every 2 years until life expectancy is less than 10 years. Mammograms combined with self-breast exams can identify breast cancer early and help prevent the need for chemotherapy and radiation in conjunction with surgery. Dr. Sokol recommends cervical cancer screenings should begin at age 21 and every 3 years. Screenings are performed via pap smear, and detecting cervical cancer early can provide a less invasive treatment plan and prevent the need for both partial and total hysterectomies. The U.S. Preventative Task Force recommends colorectal screenings should begin at age 50 and every 5 years. Colonoscopies and fecal occult blood tests can identify colorectal cancer at an early stage. More education to the public can help increase the number of screenings, thus decreasing the number of advanced stage colorectal cancer diagnoses. DrugWatch.com cites the annual cost for cancer treatment in the United States as an alarming $284 billion. Cancer has screenings and modifiable risk factors that can help decrease this number. The American Diabetes Association website has valuable information on ways to prevent diabetes through a healthy diet, diabetes screenings, and fasting glucose screenings. Diabetes left untreated can lead to microvascular and macrovascular disease. Diabetes care costs Americans approximately $322 billion annually. Diabetes is yet another disease that through a vigorous lifestyle and primary prevention can be halted or reversed. So next time you're getting your oil changed on your car, take a moment and ask yourself, when's the last time you had preventative health care and what lifestyle modification you can do to increase your life expectancy.